Hi, I'm Dr. Muralee. I'm a child and adolescent psychiatrist on the inpatient unit at the Menninger Clinic in Houston.
And I'm Chiasson. I am an associate clinician on the Adolescent treatment program, also at the Menninger Clinic in Houston.
So I'd like to start by acknowledging that adolescence has always been really difficult, but what's different now, I think, is that teenagers are trying to navigate this in a very intense environment, in a different environment where with social media, they are like connected 24/7, and then it's a little bit more of comparison and feeling judged. What do you think?
I completely agree that social media has opened a whole new world to different struggles that adolescents are facing. Nowadays, there's a lack of social connection. Adolescents are getting used to presenting themselves behind a screen. I think that has caused a lot more social anxiety. They're also a lot more exposed to major world events and things that are going on in the world around them, which can cause more anxiety and pressure. It seems like the problems that adolescents are facing hasn't necessarily changed that much, but it's the environment that they're in has changed significantly. Two specific platforms that come to mind that I've seen kind of surfacing in the work that I've done recently with adolescents is Discord and Roblox. A lot of adolescents are communicating with people who they think are other children, but it has been apparent that a lot of people on those platforms are not safe people, and they're getting themselves into situations that can be really harmful and really dangerous. So I think it's important for parents to be aware of that with social media, those platforms specifically.
Yeah. And like I said earlier, other than the increase in like the depression and anxiety, we're also seeing more and more kids engaging in impulsive behaviors and substance abuse. All of this is causing us to see a lot more adolescents in crisis and coming for treatment. Teens typically do well with structure and predictability and support. So when they are in an environment that's going to be able to provide that for them, they can learn healthy coping skills and sort of figure out ways to be able to like navigate the struggles that they're facing.
Yeah, I agree. I think being a part of a program also allows families to have the physical and psychological space to do the therapeutic work that needs to be done to improve relationships in the environment and the family at home. But I think one caveat is that it's really important that parents and families are really doing the research on the programs they're considering. It's important to look out for evidence-based practices, make sure that there's adequate staff, look at reviews, call the places, make sure you're getting a good feel for the program and making sure that it's a good fit for your child and for your family.
In a structured environment, it's not just a therapy that they're getting. It's an ecosystem of care where they are getting individual therapy, family therapy. So all of this, it's going to take a multidisciplinary approach to kind of get good results and for all of our adolescents to get good care. So here at the Menninger Clinic, we have a wide variety of treatment levels of care. Our highest level of care that we offer is the acute inpatient unit. At the acute inpatient unit, we get kids typically during a crisis. They get referred to us from like emergency room or after a medical stabilization if they've had like a suicide attempt that needed intervention. So once they come to our inpatient unit, we stabilize them and provide recommendations for the other levels of care, which we do have here at the Menninger Clinic, which is a partial hospital program. And intensive outpatient program. So the difference in these two programs are just the intensity of the amount of therapy that the kids would be getting, and that would be determined based on what the child needs.
We focus on relationships with the kids, helping the kids feel safe, providing them a nurturing environment. A lot of our kids have had negative experiences at other programs, so we like to make sure that they're having a positive experience at ours and feel safe, and that this remains a therapeutic and helpful environment for them and for their family.
We have the ability to do inpatient assessment as well, but it depends on whether we have an appropriate question that we want to answer like acutely, or if this patient can actually be stabilized first and then have a full assessment.
And unlike programs in the troubled teen industry that focus on behavior modification, we focus on evidence-based practices, relationships with the kids.
And families.
Yes, and families, yes. And kind of developing that therapeutic alliance and focusing on therapeutic interventions.
The goal is to make sure that the teenager, adolescent child is making continued progress even after they're done with our program.
Yeah, family involvement is definitely a key part of treatment at Menninger. The kids are allowed to call their parents daily. Visitation happens weekly, and there's family therapy. It's important that we get the perspectives of parents, as you know your kid better than anybody else. So you're kind of the expert in your kids, and then we're kind of the expert in treatment. And so it's a collaborative effort. It's also important, I think, that families do the work that they need to do while their kid is away at treatment as well, to make it a family effort so that the kid is returning to an environment that is healthier and more stable.
So during the time that we have a patient under our care, we also provide parents with regular updates, give them parent coaching, and help the kids to sort of, which helps them kind of reintegrate back into the home environment and to continue their therapeutic process.
Mm-hmm. It's important that parents are engaged in the aftercare planning process as well. We really focus on communication building, relationship building, and improving connection between parents and their children.
Every teenager, adolescent, even adults, they're all different. So some of the big signs that we often feel warrants attention in mental health care is if you notice that your child is persistently sad, is isolating all the time, or irritable, the schoolwork is tending to decline, poor academic performance. If that persists, it's always better to seek treatment or at least an evaluation, because the earlier we are able to intervene, the quicker we are able to help them if it's necessary, and provide recommendations for how they can get better.
Yeah, I agree. Just whenever you're concerned or if you're noticing changes in your child, the sooner that you seek professional help, the better, so that you can, figure out what the best next steps would be for your child and for your family.
I think one of the most powerful ways of treatment is when peers feel connected with other peers, and often adolescents are feeling isolated. So when they are in treatment and feeling that they're not alone in this, I think that's really, really helpful. So peer support, I think, plays a huge role in their recovery and in their process of healing.
Mm-hmm. Yeah, group therapy is a big component of treatment. So the teens are kind of surrounded by other teens who are going through similar things, maybe different things, offering different perspectives. If you feel like your child is being negatively influenced by a peer group, it may just mean that it's not the right fit, but not necessarily that they can't benefit from treatment.
from any program, when the program ends, whether it is an inpatient program or a intensive outpatient program, partial hospital program, discharge is never the end. It's just a continuation. It's a period of transition. So when the program ends, we make every effort to make sure that the adolescent and the families are connected to aftercare and sort of continue their journey. They've just kind of finished one aspect of their treatment and they need to move on to the next phase.
Yeah, we really prioritize continuity of care. So we oftentimes are connecting with outpatient providers, making sure that we're providing handoffs so that the next providers have an overview of kind of what their treatment looked like and what we feel like the next best steps would be, what our recommendations are. And we make sure that that's a collaborative effort as well, and make sure that the families and the patient feel comfortable with those next steps and are ready to move forward.
I wish that parents knew that if your teenager or child is struggling, you did not fail and it's not your fault. This is a child sometimes struggles and has to navigate a very, very complex environment that we're in. So the key takeaway I would like for parents to know is just reassure your kid that you're part of the kids team and you're there and you're supportive, so you can be there with them in their process of and their journey of their treatment and healing.
Yeah, I think a lot of times parents struggle with blaming themselves, but even if you feel like you were maybe part of the problem, you can be part of the solution. So I think it's important to seek help when there is a concern about your child. Just seek professional guidance sooner rather than later, so you can be a part of getting your child the help that they need.